Malungil sil merwek adroguy. And Happy New Year to you. Akmal mering asulin mo sa ilukot makatiyan niya abal sa ila program ra Kausischakl. Malungil arngut kada mal mering asaul. Le arges tergidir elang amlara aroy del belul may. Despite tertial niya COVID-19, yang mo subo ilukot makli omroli re merbelaw. El merbelaw yang mo sa ilukot patial program, mo gertil wasay. Tial lomrolin merbelaw ngram tem merbelaw el all time. Mangman mo gular mo din cloud to tell information amo sa dalo yung tial program mo remains masu manguk kanga rablay morgo soam tial tolo sa other ni maurel loru ni galat maybe mo sa bilo spectate del program mo ay sila say kamgarang mo sa mo access ay kay digital services del tira provide makmal di nga suliw adi akmo mesti te elir mendi mo til mal ko introduce tir hindi era mo domo le di bo ay sila say tiragal tetil ngatiang al momes setir tirga ngarsel Shing medical memorial hospital el ngargia Dr. Terry nga pediatrician nga atok tangaranga laga mangari Dr. Nancy el guk ngarsel duraseng family medicine of course engel ngarsel among Chailin nga umbes ko apto kala adam dangali nga mlamo erura kal karbelaw orior rasinggo nga Palau National Hospital magdala apto kal kita other belaw na madangali ngani tergibal sa sel ar to belaw. So thank you Dr. Terry, Dr. Nancy and Chailin for this opportunity for you to be able to come and to share with the viewers this important mission and the work that you do and we thank you for that. And Happy New Year to you.
Happy New Year, guys. Happy New Year.
So I just introduced you guys to the viewers, and so maybe I'll give the mic over to you, and so you can also introduce them, introduce yourself, and maybe we can start with the whole purpose of the mission here.
Yeah, of course. I will just give a very short brief.
Sure. Okay.
Yeah. Hi everyone. This is Talungab. I'm from Shing Hospital, and I'm a coordinator of a telemedical program. And this time, during this pandemic, our hospital dispatched a medical mission to Palau. So this time we have 3 doctors, which is a pediatrician, family medicine doctor, and there's an orthopedic surgeon in hospital now. And also we dispatch a pharmacist from our international healthcare center. And this time, because Palau need this specialist here, so we work very hard to make it come true. And these doctors are really kind-hearted. They willing to come here during this pandemic because they're going to be quarantined when they go back to Taiwan for 14 days. And then thank you Palau for having us during this pandemic. We have chance to be here during this COVID-free time. And then so let's just give the mic to Dr. Terry and Dr. Nancy for today.
Okay. Dr. Terry, then we'll start with you.
All right, hi guys. My name is Dr. Terry Kwol. I'm here as a pediatrician, and I specialize especially in pediatric gastroenterologies and pediatric nutrition. And being sent over here, it's my honor to be here. I was here last year, and I loved Palau. Everyone in Palau was really they welcomed us from the heart in this beautiful weather, beautiful island with beautiful people. I'm just happy to be here. And then I'm gonna turn the mic to Nancy.
Okay. Hi everyone, I'm Nancy, Dr. Nancy Chen, and I'm a family physician. So I'm here this time basically to screen for chronic diseases such as diabetes, hypertension, cholesterol problems, stuff like that. And I'm just gonna talk briefly about diabetes right now. So for people who don't know about what diabetes is, it's basically a condition where the level of glucose or blood sugar is too high in your blood vessels. And what it does is, in the long term, it's gonna damage your nerves and your blood vessels, and eventually it's gonna end up damaging your kidneys or eye vision, stuff like that. So because most often time people don't have any symptoms when they have diabetes, they don't know that they are actually diabetic. So we actually brought a portable machine this time, and it only takes about 15 minutes to get a screening to see whether if you're diabetic or not. So basically, if you are age over 40 to 70, and who are overweight or obese, you should definitely get a screening to see if you're diabetic or not. And the machine can also test for cholesterol problems. So basically, in 15 minutes, you can know if you have cholesterol problem or diabetes. So yeah.
Thank you, Dr. Terry, Nancy, and Jailin. So, you know, when we talk about Shing Hospital,
Yeah.
I'm sure a lot of Palauans, they have this personal connection with Shing because they have family members or they themselves have been there for medical services, referral medical services. So I know that. And also, this latest mission from Shing is the latest, and then they've many others that have taken place earlier. So just to start off with, when did you arrive here, and how did you and did you go into like quarantine before you come here, or can you explain that?
Okay, so basically, we were sent over here on December 13th
Wow.
by airplane.
Wow, that's
The China flight.
you've been here.
Yes.
Yes, and then
Oh,
after we arrived in the middle of the night,
Yes.
and then we were sent
Very
to
early
the
morning.
quarantine
I see.
hotels,
Hotel.
where we stayed there isolated and then for 7 days straight without interacting with people. They just send over the meals at the door and they knock on it or inform you the meal is ready, and then but you can't open the door, so because you'll be seeing the people there. So after they put down their meal and we just open the meal and we get it. It's just like people free. So at first we were enjoying the peace and quiet ourselves, but then we were getting like, you know, we were really desired to see people or talk to people or interact with people. And then after we were sent out, it was just like heaven. Everyone, you see actual people, you eat actual food, and it's like warm, and it's like, you know, it's
And
just happy.
Actually, we were really surprised that the isolation, quarantine policy here is really strict.
Yeah.
And
Yeah.
so I think that's why we keep Palau COVID free.
Right.
So thank you,
Yeah.
Ministry of Health,
Yeah.
and
Yeah.
the people working hard here.
Yeah.
Yeah, and the hotel,
Was
the
nice.
facilities was
Yeah.
really nice, and the staff were really informative. Like they know we wanted to eat some snacks or like necessities,
Yeah.
and they provided us with it. So we were much grateful than having the Ministry of Health helping us, and then like people of Palau working with us. We're like really thankful.
Yeah, thank you. So now that you're out there,
Yeah.
looking at the patients, so what sort of services did you bring here in this mission, the latest mission?
Just like Dr. Nancy mentioned, we brought a portable analyzer that you can diagnose your diabetic or not within 15 minutes. Yeah, and then also, so after the 15 minutes, Dr. Nancy will just prescribe medication. We'll just do some change on the medication.
Yeah.
And for Dr. Terry,
I brought in 2 ventilators. Was just a very basic medical needs for the babies in Palau, because some people, when they are born distressed, they may need ventilators, and this is just a bridge for them to recover from their stress. And then because for people in need, like for babies, we don't want to intubate them because it's very invasive. So we try to keep it as least invasive as possible. So I brought in 2 machines that would help the babies to, like, you know, bridge to their normal breathing circles. Yeah.
Yeah, because I was looking at the Ministry of Health Facebook page,
yeah.
and then there's pediatrics, orthopedics, family medicine, and pharmacy counseling. Can you explain each one of those and how can people?
Okay, so for pediatric and family medicine, I think we have already explained.
Right,
But
right.
for orthopedic, it's just like because Palau, we don't have ortho on the island.
right.
And then we know that recently it's holiday season, so
yes.
there are so many accidents. So ortho here is mainly provide surgery and OPD for a clinic service. And people who have low back pain, they have arthritis, which is they have knee pain because of degeneration. Then doctor can solve the problem, and we'll just check on the X-ray and probably prescribe some medication. We'll do some injection. But for our pharmacist, we brought the skin ointment here to like treat eczema.
Eczema.
Yes.
Or fungus infection or
Yes.
bacterial skin infection. Yeah.
So if you need this all services, you can just go to the hospital to make appointment or call OPD.
Yeah. You know, we really need to thank you because you're during this holiday season. You're not with your family. You're taking time away from your family, you're coming here and you provide this service. So we really thank you. So how has the public been? Are there many patients that have you seen during the time that you've been here?
Because I go around the dispensaries.
Okay, so
Yeah, so I would say on average, every day I have about 10 to 20 patients.
Wow.
Yeah, so because the machine takes 15 minutes at least to run, so I would say that's a lot
that's
of
a lot.
patients.
That's a lot.
That's right in terms of Palau's population.
Yes.
And
Yes.
those villages, they don't have that many people.
Yeah.
So
So
that's
yeah.
okay, yeah.
But we're glad that people, they have the awareness
Yes.
that they
Right.
need to go check and they need to see the
That's very
specialist.
important.
Yeah, that's very
Yeah.
important.
Yeah.
Yes.
Yeah.
That's very important.
And
So-
for pediatric,
Yeah.
Well, because I have walk-in clinics on Tuesday and Thursday morning as the B&H, but we also do appointments, medical appointments at the CHC.
Okay.
So on average, it's about 10 to 15. Like maximum, it's like 15 people. But other than that, sometimes it's just quiet, slow days. But I'm still glad because I get to interact with each families and then get to know the real problems, or like because even though because what I do is besides general health, I have to educate on pediatric nutrition as well. So this is becoming more of a problem because as the country is getting more advanced. When children are getting more than the nutrition they need, they tend to be overweight and obese. And then in the long run, when they're children, we won't say you're obese or you have health problems. But when they grow into the adult life, this has become a burden. So that's why diet educations and proper exercise plannings and their dieting is it's what the most important thing is.
That's very true and very important because the latest there was a latest report from UNICEF, and Palau is ranked second in the whole world as the second most, having the most overweight and obese children after Nauru, and it's not that far behind Nauru. No, it's just something that we need to do something about it. Get people educated, get people, know the proper diet. I'm sure a lot of people will be watching this tonight or now, and they are wondering like if I need to see an orthopedic a medical, how can I be able to access these services while you're here? How is that?
Actually, I heard from OPD nurses or the medical records staff. They say there are already 290 patients waiting for orthopedic surgery.
Wow!
Yeah, so
For this mission?
yes,
Oh man!
yes. So it's already lined up.
Yeah.
And then because we only have limited time.
You should extend your stay here.
No, they want to go back for Chinese New Year in
we
February.
we want to go.
No, but don't worry, we'll consecutively sending doctors here to assist Palau. But just this time, if you really need orthopedic consultation, you can just register yourself in Palau National Hospital OPD, and then they will prioritize and see if you really need to be seen by doctor. Yes.
Oh wow! This 290, and I'm sure that the other
It's
missions,
still growing,
the other missions that have come prior to this one. Also, I know that the same orthopedic. Maybe there's even more numbers that came.
Yeah.
So if the orthopedic is 290, the pediatrics, is it like a lot or also?
But also,
It's
because we
well comparatively,
compared
to the orthopedics doctor, like we are having a slow and easy day compared to him because for us we regularly see people, but for the orthopedic surgeon, because he's a surgeon, so when there's needs, he needs to operate on people, so that's why he has limited outpatient clinics because at sometimes he's gonna get call from the hospital and at night in the middle of night to operate. Maybe.
So you also do operate.
Yes,
Yeah.
yes.
Surgeries,
Surgeon also do
yes.
operation.
You know.
Yeah.
when it needs,
Yeah.
So he's gonna get a busy life than us.
So you know,
He's so
I'm,
tired.
you know, I'm just trying to get the profile of these 290 people.
Yeah.
And I'm just like, what sort of orthopedic ailment do they come in with?
Mostly the complaint is low back pain and knee pain, just like I say.
Okay,
that.
I'm beginning to have
Yeah.
a
Yeah.
Joints, any joints.
Yeah, the joint pains, shoulders, and like arms,
Yeah.
anywhere.
Yeah.
So the most effective way to prevent this, you need to do exercise to train your core muscle
Right,
to stress
But
and
exercise right, do it right.
Yeah,
Do it right. Don't
do
do
it
it too
right.
much. Just do it
No
right.
injuries.
if you experience a back pain or you have numbness among your feet, just do not do a sit up. Yeah,
What's that?
sit
Sit-
up.
sit-ups.
Sit-ups.
Like
Sit-ups.
If
this.
you have a numbness on your feet? Or
Yeah.
Probably
If
you
you
have
feel-
some
back problem.
back problem.
Yeah.
Yeah.
Okay, I see. You know, and for like family medicine,
Yep.
for pediatrics, when the patients come in, what is usually their, what are they there for? You know, like what kind of ailment do they?
Okay. So for me, the most complaints I get is just they have NCD already. They're diagnosed with, for example, hypertension, diabetes, cholesterol problem, and they're always on medication, but they're not really sure what these medications are for. I have some patient, they comes in and we do a screening, and I was like, oh, you're already diabetic. But he didn't know, but he was already on medication for diabetes. But he didn't know what this medication was for. So basically, we explain to them what these numbers mean, because oftentimes they do their routine lab works, but they don't know what the numbers mean. They don't know what they are. They don't know how they're doing. So I just explain to them what they are and let them know what they can do and if they need to change the medicine.
But those kind of information, do you share them with the Ministry of Health? Because you know, like if the patient comes in and doesn't know what this medicine is all about, then you should. I'm just assuming that that information also should be given to the Ministry of Health. So you know, when you leave,
Yeah.
then they'll be
Yeah.
able to continue.
Yeah, we'll put it
Yeah.
on chart as a
Yeah,
record.
it's on the
Yeah.
medical chart. Yeah.
Yeah,
Their
Of course.
physician can track.
Sure.
yeah.
Okay. And what about the pediatrics?
For us, well, we are separated into two categories. One is the general screening, because the Ministry of Health and also the CDCs, they provide a series of follow-up for people, for children with vaccines and just general health inspections. So that's the follow-up part. And the second part is mostly acute illnesses. Like recently, there's a flu outbreak, and then people are having like fevers, and then just general common cold and stuff. So that's what I get to see. Like most people are like just we follow up on their like regular needs or like their weight and their diet or like their development. We're like tracking if they're doing everything's okay, either like cognitively or neurogenically, just following them to see if they are on the right tracks or not. Yeah, so that's what we do.
So for this, so you've done all the dispensary around the Palau, or?
Not yet.
Yeah, not all of it, yeah. But I've been to the one in Irai
Right. Okay.
and the one in the east and the west, and we will be going to Palilu and
Palilu and
Angar.
Yeah.
Next week.
Week.
Okay.
Yeah,
Oh, and
we
then-
have the schedule on the MOH
Yes,
Facebook.
Yeah. Okay.
Yeah.
Okay. Yeah. You will be leaving on the January 14th.
Yes.
On another flight.
Another charter flight.
Yes.
So in this mission, you have how many doctors with you?
3 doctors, 1
doctors.
pharmacist.
And 1 pharmacist. Okay. So the pharmacist is here doing what exactly? I mean, is the pharmacist helping the pharmacy here at the Milwaukee Hospital? Or?
Most of the time we do like a medicine counseling because some people they're just not sure which medications they're on, and then they have problems or if they have questions towards their medications.
Okay.
So we would have, because Nancy is really busy with all the blood tests and stuff,
Okay.
so anything regarding the medication part, we refer to the pharmacist. And also, she also dispenses some of the skin ointment that Palau one needs, like because some people are having skin problems, and then there's sometimes it's not enough, so we provide them with like extra ointments.
Okay, so I'm trying to understand that. So that pharmacist will be here, and then you can make an appointment to see that pharmacist and see, like, do you have any remedy for my skin itch or something like that?
Oh,
Or-
usually it's mostly seen by doctors first, and
Okay.
if the doctors
Okay.
need it, they will refer her
Yeah,
to
we
the
refer to the
pharmacist.
pharmacist.
Yeah, but for more
appointments.
details, pharmacist will explain.
Will explain.
Yeah.
Okay, I see.
Yeah.
I see.
And then when she's also here, we're collecting the medicine list from private clinic and hospital, because we know there are many referral patients, and sometimes doctors prescribe the medication in Taiwan. Probably we cannot reach it here in Palau, so we're trying to get the alternative medication for local people, so they don't need to get the medication off island and purchase them and wait for a long time to get their medication.
Yeah. So for this mission, also those patients that were referred to Taiwan, will they also come here and use this
Yes.
to follow
Follow
up on
up.
their
Yeah.
Yes, that's
on their method?
important.
Okay. Yeah, yeah. And there's many of them.
Many of them.
And so how many times does Shing Kong send mission here to Palau each year? You know?
We have this program here since 2012.
Right.
Yeah,
Okay.
and then we consecutively sending medical staff,
Yeah.
and also we train local people
Right,
to
okay.
do the medical personnel training, working with ICDF, which is there's ICDF. This is funding for
Right, right.
MOFA,
Mhm.
Taiwan MOFA.
Yes.
Yes.
Yeah. So during this mission, and then you get to see patients of all sorts, different. What happens if there's a a very serious condition that requires more sophisticated medical care? What do you do?
If we really encounter that situation, we cannot do it locally. We were just considering sending them off island.
Yeah.
To do the referral.
Yeah.
Yes.
You have a referral programs, right?
Yeah, we
Yeah.
have a
Yeah, we
referral
have a
program
referral
here,
program.
and we work very closely with a medical referral program.
And any during it's very interesting because you're going around
Dispensaries, yes.
in Aira and then Malgoyok in the east
Maligro
and Ngaramlong in the west.
Yeah.
But there's one up north in Ngaralong.
Oh, because it's under renovation.
Oh,
Today
okay.
it's groundbreaking. So
Oh.
after
Yeah.
that, we will go there.
Okay.
Yeah,
Yes.
next week I think. Next
And
week.
because also I received word that the CHC in Peleliu, the dispensary is also
Under-
closed.
Yeah, but the
Yeah.
services will not stop. Yeah, you just move
They
to
just move
another
to
place.
another-
Move to
but
another
we will-
smaller
Yeah.
facilities,
I
but
see,
we
I
will
see,
be there.
I see,
Yeah.
I see, I see.
We will still
Okay.
providing services here,
Yeah.
there. Yeah.
Okay. How many operations so far?
For
Four.
orthopedic,
Yeah, for
we have five
Or four.
five surgeries since
Since you
since I arrived.
Since
This
we
is
got
the
out of
opening.
quarantine.
So I'm just this 290 just comes to much so prominently.
Yeah.
I'm just like, man, the orthopedic probably has no time to rest. It's just gonna be like looking at everybody, until the January 14 when you guys are about to go.
Yeah, but so that's why we only accept the appointment, because we
I see.
cannot really
Yeah.
take all walk-ins in one time.
I
Yeah.
see,
So we
I
can
see.
let him have time to take a rest.
Okay. Do you also where are you based at the Palau National Hospital, or do you also go around each of the community to?
For pediatrics, we do mostly at the B&H hospitals and the CHC. That's in Koror,
Yeah.
but I will be heading down to
Peleliu.
Peleliu and Angar next week as well,
Yeah.
along with Dr. Nancy.
Yeah. So
Yeah.
we
Do
will
the
be
outreach.
Yeah, we will do the
Yes.
outreach programs over
Alright.
there.
You talked about NCD, which
Yes.
is also when you talk about NCD, there's a lot of risk factors.
Yes.
In the diet, the nutrition is also the most play an important role in NCD.
Yes.
And NCD in Palau is also a major medical issue, health issue. Do you get to how I'm just trying to get you a bit, because you're seeing patients with NCD issues.
Yes.
What's the main cause of this NCD that people come and see you?
I think the main cause for NCD in Palau, first of all, is overweight, obesity, and maybe a sedentary lifestyle. So
Yeah, right.
I've seen people usually they drive instead of maybe walking or biking.
And this is just everything is very close business, but you choose to drive a car.
And also betel nut chewing or tobacco chewing, that actually could cause hypertension as well. So those are some of the main risk factors that I've seen so far. And also, if, for example, if you're diabetic, maybe you're in risk for getting hypertension and hyperlipidemia as well. Like these three factors, they affect each other as well.
Yeah.
So.
What about smoking cigarettes?
Smoking cigarette is one of the risk factors as well, but I found in Palau most people chew tobacco instead of smoking. Yeah.
You know, one of the I think an issue with the health is that a lot of Palawans who are on referral outside usually have a heart problems. Is that has anything to do with NCD or?
Oh yeah, of course. The purpose of NCD is basically to prevent any heart disease or even like stroke, cardiovascular disease. So these are the two main organs we want to prevent. And so because if you have NCD, chronically it might cause stroke or heart disease, but in the short term you won't have any symptoms and you don't feel anything, and some people just forgot about it. And then one day when they had a stroke and they realized that, oh, I've been having NCD all this time, but I never received treatment, never knew about it. So that's what we're trying to do. Yeah.
Just to get them to to see a doctor or to the
do a
hospital,
screening.
The screening.
Yes.
Don't wait until everything is too late.
Yeah.
Yeah. So also, I think in Palau, diabetes is a big problem, and I think maybe a large percentage of the population, or maybe not, but in comparison to other countries, I think we have a high prevalence of diabetes. Yeah, and why is that? I'm just trying to is it also diet related or
genetic is one of the factor, and maybe race is one of the factors as well. Diet wise, yes, it would be one of the factors as well. Usually, being obese already is a risk factor for developing diabetes. So a lot of people, they drink maybe beverage instead of water here, and they have canned food, a lot of canned food here. So that's also one of them. And for cholesterol, people here, they tend to eat like organ meats. I've heard some Palauans saying they like fruit bats, and they eat the entire fruit bats, like even the organs and the brain, which is filled with cholesterol.
The organs are the tastiest part.
Yes, that's what everybody told me.
Yeah,
Yes.
but also high in cholesterol, so
And,
we can
sea
have
turtles
some,
too.
but not too much.
Not all.
So organ meats is one of the problems, especially the brain. The brain parts, it's filled with cholesterol. So I think diet is one of the problems as well, and exercise.
Exercise.
Yes.
Yeah, just need to get everybody to exercise.
Yes.
So for the children,
Yes.
okay, when a mother brings in a young child to come and see you, what sort of issue they have, or do they want to know?
First of all, they just want to know if their babies are doing okay, if they're like acting like other people as well. But like most of them have some nutrition problems. Some of them being underweight, some being overweight. And then we just encourage breastfeedings because I think breast milk is the best kind of food for babies.
Yes.
But then, however, when they're getting older and when they reach 6 months old, we have to bridge them with complementary food. And complementary food being like they have rich in like irons and like vitamins, and these kind of nutrients, they help the babies grow into better. They have like better nutrition, and they can have good weight, and they won't be as picky eater when they grow up. Because when there's research that has been notified that if you are less than a year old and you don't like eating complementary food, when they grow up, they're going to be very picky eaters. And then we know like when they're not eating right, they're just not growing right. So that's why we promote like breastfeeding the babies and then bridge them with complementary food. And when they're 1 year and older, we just ask them to eat of as much variety of food as possible, but also on the nutrient basis. Like you have to get them to eat vegetables, you have to get them to eat fruits, some meat, like the proteins. That's good, dark meat as well because they're rich in irons. And then milk, daily drinking of milk, we would advise like 400 to 500 cc's of milk daily. These are the medical aspects when we're talking about eating right and then just eating healthy for the babies and for the children. Because we want them to have a good head start when they go into the life they're going to face later.
Yeah.
So pediatrics is from 0 to how?
Well, it's from like anything 0 to 18 years old.
Okay, so that's...
Yeah, so we are responsible for a lot of, cover a lot of ages, yeah.
Babies to teenagers.
Babies to
babies,
teenagers,
you know,
yeah.
We need to have more babies here, because
Yes, that's true.
we call, and after the Christmas day, then we call the hospital and ask if we had a Christmas baby, because I work in the news and I want to report that. It's like there was no Christmas babies. I'm hoping that we'll have a
New Year's
Year's
baby.
baby. Yeah,
Maybe. We're waiting for one. We're
Yeah, we're waiting
expecting
for
one.
one.
We're expecting
we're
one.
expecting
so,
one.
yeah.
Okay, so that will be a good news.
Yeah.
We'll have something to report on the New Year's Day.
Yeah.
So from now until the 14th, you will be living on the 14th.
Yes.
You have apparently you have a full set of schedule,
Yes.
and do you also go around and like visit schools and talk to the children, or?
Actually, we're planning to, but then it still depends on the school's schedule. So
Right,
we are
right.
still
Yeah.
talking with principals.
And it's a holiday break, so there's
Yeah.
no school, and so
And
you
then
know.
every beginning of the semester, they're really busy.
Right.
Yeah, so
Yeah,
we're
yeah,
trying to.
Yeah, because this information that you just shared are also information that really needs to be out there for the people to really get and to be aware of how to improve their health and their children's health, and how to maintain a good all around healthy living.
Yes.
Yeah.
Yeah. So you've been here once before.
Yes.
When was that?
It was August last year. Last
August
August.
last year.
Yeah.
And you?
Yeah, I've been here. This is my second time as
Second
well.
time
I was
also.
here last November.
Last November.
Yeah,
Oh,
for 2
wow,
weeks,
wow.
so-
Yeah.
We're just happy to have you every time you come.
Yeah.
Thank you, guys.
So the last time you were here,
Yeah.
You did the same thing,
Yeah, I did the same thing.
and how many last year compared to this year? Are you seeing like about the same number of patients?
I think this time is more. I've seen more.
More.
I think because of longer stay this
Yes.
time, and also we did some outreach. We promoted
Yeah.
that we're screening more people,
Yeah.
and then we
So
sent
we
the
can
news.
reach
Yeah,
more.
we sent the news out so more people, like when they're in need, they can come to us. Because last time it was on a very short notice,
Yes.
and then I came here, I didn't see much, but then I knew I had to do something again. So I was sent here again. So I'm trying to do my best. Yeah.
And Dr. Nancy, the same
Yeah.
question to you. Are you seeing like about the same number?
Well, last year when I was here, Taiwan Roots was also here.
Oh, okay.
So there were a lot of patients at that time.
I remember that time.
Yeah, so, well, but I think this time compared to previous years, I think more patients are here this time. Yeah, so I think people are more aware of the importance.
And maybe that the numbers that you see, the increased numbers of patients, is maybe because of this COVID-19. People are becoming more aware of their health.
Yeah.
Yes.
And
That's
they say
good.
like, oh,
That
maybe,
is good.
you know, like since we have this team coming here, I better go check my health. You
Yeah.
know, you know, it's just COVID-19 is a very devastating, but there's always that silver lining. Eh?
More people
Like,
going
more
to
people
exercise.
going to
Yes.
Yes.
So you know, we thank you for coming in. For the Ministry of Health, they had this good relationship with Shing Hospital.
Yes.
And as I said earlier in the beginning, that a lot of Palau people have this special connection with Shing because their family members or they themselves have been to Shing Hospital for medical referral.
Referral, yeah.
So I know. Do you get to see some of those from the medical referral coming in and see you?
Yes, yes. I had a few patients that as I was going through his chart, and then I realized I saw my names in his previous medical chart. Yeah, because the name was written in Mandarin, it's in Chinese. And then I was reading through it, I was like, oh, my name's on it. So I've seen you. And then, interestingly, Dr. Nancy,
Yes.
when she was doing her pediatric rotation,
Yes.
she was also saw the patient. So
Yeah.
we were like, oh,
I had a photo with the
yeah,
patient.
she even took the photo with him. So it was just, we were happy that he was thriving well, he was
Yeah.
doing good. So
And
we
I'm
just
sure he was
providing-
happy to see you there.
yeah,
Yes.
and then,
We're
yeah.
providing continuous care.
Right.
Yeah, it's
Right,
really
right.
good. I think this medical program between the Taiwan and Palau is really good because we are learning from like what
Each
we're doing.
other.
Yeah, we're learning from each other.
Yeah.
Yeah.
That's. Do you have anything you want to say?
No, I'm good.
Just so proud of ourselves, and
Yeah.
then also thank you, Palau, for having us.
Yes.
No, we are happy always to have you here because you know there's so many who wants to come and see you, and if there's more time, and you know I'm sure that the waiting list will continue to
Yeah.
more
We
and
will-
more.
Yeah, we
come
will
and see
send this news back to back to Taiwan and to
Yes.
Shing Kong.
Yeah, maybe send more orthopedics.
Yeah. No guarantees though, but we will try our best.
We try
Yeah,
very
we try,
hard to
yeah.
work on this.
It's been a challenge during this COVID-19 environment, especially like the flight that has all shut down.
Yeah.
It's very hard. I'm sure you came here and then you had 7 days in quarantine, and
Yeah.
and I think that's the challenge. And then even if you go back, I'm sure you will be
14
14
days.
14 days.
So 21 days.
Yes.
Yeah.
Will be in isolation.
Yes.
You know, it just go away, and that's just the hard part. You know,
Yeah.
I'm sure like seeing patients, it's your profession, so it
Yeah.
comes with being away for 21 days. You know, you go there on January 14, and then you come out on January 28,
Something like
Yeah.
that.
Yeah.
in time for Chinese New Year.
Yeah. In time for Chinese.
Yes.
Yes.
Just in time.
Okay. I thank you. I mean, so maybe I'll give you guys, you know, an opportunity to tell the viewers or to share whatever I was not able to ask of you, and then we can go around, or we can go like this, and then we'll say new to our viewers.
How about we go this way?
Okay, we'll start with Dr. Terry.
We'll
I
start
think
with me.
everything is like, oh,
Yeah, I think I covered pretty much everything.
Okay.
Just kids, eat your vegetables, and then having good amount of meat, like the red meat, and then eat really dark colored vegetables because they're good for you. And do not drink too much sodas. Just like, you know, because I know sodas are good. I like sodas too. But then just, you know, once in a day, or like once in a week, or 2 times in a week, I think it's just good as, like, you know, everyday drink. So drink your water and eat your vegetables, and I think you will be really good. You'll be in good hands. Just
Okay.
yeah.
So I have a question.
Yes.
The kids will have to eat the red meat, the dark meat. What about us adults? Can we do that?
Not too much.
Maybe
I will.
not
I
too
will.
much.
It's the adults who get to eat the large portion of the
Yes, yes.
Yes.
But because when I say like dark meat for children, it's because they're fortified with irons, and then and children say when they are growing up, they need the
Iron.
certain amounts of irons and calciums, but once they're getting enough nutrient, we will stop. Tell them to not eat too much of it, and then when they're growing into adults or even adolescent stage, we'll tell them, if you're being overweight, if you're gaining too much weight, we will tell you to slow down on the dark meat, rather than we will tell you to switch into white meat, like, you know, chicken breast and fish. I guess Palau has a really good source of protein because you guys have a lot of fish. So fish is good. It's a really good source of protein as well. But I know dark meat is just irresistible to adults. But there are also sometimes they're a burden to the adult life. I'm sure Dr. Nancy can comment on that.
Yeah. So if you want to know if you can eat red meat, maybe come and do a screening first to see if you have any cholesterol problem. If not, then you can keep your diet as it is. If you have cholesterol problem, maybe we need some adjustment with the diet plan. Okay. So yes, we will be here and come into the dispensaries or B&H at the hospital for screening. Anyone with age over 20 who has obese, you can come and do a screening. Yeah.
Okay. Thank you, Dr. Nancy. Chidin?
Okay, I think I would just talk on behalf of orthopedics.
Please do.
Many low back pains and those muscle pain, because of obesity. So you can solve this problem by losing weight. It's really important. Okay, and then train your core muscle. That's another important thing.
What's a core muscle?
You can just go on YouTube and then search for
The
the
core muscles are like the muscle that's supporting you, because our back is like only the bones.
There's a spine,
but
bones.
we're training the muscles around our spines, even on the tummy, on our abdomens, and our
I thought you
back.
told me about this.
No, these don't do much when you're having lower back pain, okay? But this is like joint pains, but from core muscles, because they support you as the whole thing. So it's important to train them, because when
six
you
packs.
yeah,
Or
we're
ab
aiming for 6 packs,
Aiming for six.
Aiming.
but not just like
Or round pack.
yeah. We will work there. We can work from there.
And then the very important concept is prevention is always the
Yeah.
best treatment, and not
That's
treatment.
true.
Just
Prevention is the best.
Yes.
So do the annual physical checkup. Very important.
All right. Thank you. We are really happy that you will be able to take some time of your duties
Yeah.
and stop by for this. And I'm sure these are very important information that you have provided to the public, as well as the importance of this mission that comes in, and the people who can see this and will be able to to come and register for your next mission come here, and also just to be aware of the importance of maintaining a good, healthy lifestyle. I think that is the most important.
Yeah.
Yes.
As we know, like Palau is not in a very good light when it comes to obesity and overweight people. So we thank you very much for this time.
Thank you.
Thank you.
As I said, it was good that we were able to communicate, and then we had this program, to end the year.
Yes.
Thank you so much, Dr. Terry, Dr. Nancy, and Chailin. Thank you so much, and Happy New Year to you. On behalf of this TMC studio, and as you see, there are some people who are very much part of this, but they're not being seen. We wish you a Happy New Year to you and your family.
Yeah.
Thank you so
you.
much.
Thank you so
Thank
much.
you.
Happy New
Happy
Year.
New Year.
Happy New Year.
Happy New Year,
To
guys.
TMC studio and Palau.
Yeah.
Happy New Year.
People in Taiwan.
There are also people in Taiwan. Yes.
So
Happy
around the
New Year.
world.
All right. Thank you.